after talking.
Assalamu alaikum, everyone. Welcome to the 7th session of the webinars being conducted under the title of COVID-19 Pandemic and the Role of Microbiologist. We'll be starting in just a few minutes. We're waiting for Dr. Iqbal, so please stay tuned. In the meanwhile, I'm going to discuss the certificates registration with you guys. For all your previous certificates, if you haven't received them, please check your spam folder. Okay, so we can begin the session now. Welcome to the 7th session of the webinar being conducted under the title of COVID-19 Pandemic and the Role of Microbiologist, being hosted by the ASM Ambassador to Pakistan, Dr. Saeed Khan. Today we have an esteemed guest with us, Dr. Iqbal Chaudhry, who is the Director and Professor of Bioorganic and Natural Product Chemistry at the International Center for Chemical and Biological Sciences, HEJ Research Institute of Chemistry, and Dr. Panjwani Center for Molecular Medicine and Drug Research. He is also the Coordinator General of COMSTEC, which is the Organization of Islamic Cooperation Standing Committee on Scientific and Technological Cooperation. He has trained hundreds of young researchers, and his contributions have been recognized by prestigious national and international awards and honors, including the Hilal-e-Imtiaz, Tare-e-Imtiaz, and the Tamga-e-Imtiaz. He has been on the front line and working to control the pandemic from the very beginning, and has made unlimited efforts for the nation. I would like to welcome Dr. Iqbal for the session. You can unmute your mic and you can
Thank you very much, Hafsa. Thank you very much, Dr. Saeed Khan. I see a lot of people, so good morning. Apparently from different countries, good morning and good afternoon. Thank you very much for organizing this very important. Dr. Saeed, Assalamu alaikum.
Thank you so much, sir.
Very important session of on a topic which is so relevant and so timely, and something which is extremely important for all of us to understand. And I think the role of microbiology is extremely important. We have seen how this pandemic has emerged and how it has overwhelmed the system all over the world. So if you want me to have a presentation now, or just opening remarks, shall I go for the presentation, Dr. Saeed?
Yes, you can share your presentation.
Okay. इसको minimize कीजिएगा. Side से. Okay, so my presentation would be largely a broad-based, where science and technology and COVID, how science and technology has responded, and what are the challenges and opportunities for Pakistan. So I hope you can see my presentation and hear me loud and clear.
Yes.
Yes, sir, it is very clear and I can see it. Thank you so much, sir. Please proceed.
Okay, so, we all wish to return to the normal, but the fact is that what we have today is a result of what we perceive to have normal. We have seen the current model of has led to increasing deforestation, biodiversity loss, climate change, urbanization, and that has led to greater human-animal interactions, which microbiologists understand better than me, leading to jumping of many of the diseases in wild animals into human being. And this would continue if we continue the same trend of modern life. COVID-19 pandemic, as if we all understand, has already taken a huge toll in terms of social and economic consequences. And literally millions of people have already died. It is so unfortunate because something which could have been prevented. Uh, and then we have hundreds of millions of people already infected. The global economies are melting down. There are lots of unemployment. There are many countries who really gone into a downturn of economic loss and would perhaps not recover in the near future. And there are literally trillions of dollars of global economic loss. Many countries have seen the worst which has happened. And as per Melinda Gates say, that any crisis, any pandemic has magnified every existing inequality in our society. So we have seen the difference of haves and have-nots. We have seen gender inequality, poverty magnified as a result of this pandemic. COVID-19 has triggered lots of good and bad things. The good thing was that science and technology responded. I think science and technology were the two sectors which responded as per expectation. And never in the history of humanity, science and technology was so promptly deployed as we have seen in this global pandemic. The example of HIV, we know already that HIV, we're still struggling with appropriate therapies and vaccines of HIV. But in case of SARS-CoV-19, the global response of science and technology against the pandemic was absolutely phenomenal. This was extremely remarkable and had turned calamity into opportunities because many countries of the world with low level of science and technology competencies were able to respond very nicely by effectively using the existing strength. So pandemic has exposed the importance of good governance, social justice, investment in health and education, and most importantly, indigenous capacity. I can't move. Okay. And this is the only sector which has matched the pace of COVID-19 spread. And, you know, I don't really need to tell you how quickly everything happened. That within the 6 weeks of the discovery of this mysterious cluster of pneumonia-like symptoms in Wuhan, the German and Chinese scientists have already, Chinese and Australian scientists have published the complete genome in January. This genome was then taken within few hours, and people start working already on PCR-based kit development, vaccine development. Germans and Chinese have brought huge quantities of kits for diagnosis, and you know we have seen that within few weeks the kits were available globally. And most importantly, the biology of virus was deciphered. It was very, very important because the way we were able to handle, and hopefully in the future uh, we'll be able to do the same, was largely because the understanding of biology of viruses which were developed and in which microbiologists have played an extremely important role. You know, how this virus behave, what is the molecular structure of this virus, what is the mechanism of infection, how long it remain airborne or surface borne, how quickly it is spread, and how it can survive in non-symptomatic individuals who can then become super spreader. So the entire science of virus was deciphered in the most efficient manner, and that has led to what is called public policy interventions. I work for the Prime Minister Task Force for COVID-19 also. And we've been closely observing what has happened, and those interventions actually helped us to understand and contain that. So what you see is in terms of mask or social distancing or surface cleaning and use of sanitizers and hand washing was largely because biology of the virus was deciphered within a few weeks, and thousands of papers were published. And that we have seen, in the absence of drugs, there were many drugs which were repurposed. Doctors tried many drugs, and hundreds of clinical trials were conducted within few months on existing antiviral, anti-inflammatory, antiparasitic diseases. Ventilators for a huge number of patients were manufactured and supplied to the world. Many countries who have never had any ventilator indigenously manufactured were able to do that. Modern technologies, artificial intelligence and IT were deployed in disease surveillance, tracing, and tracking. And within the 10 months of genome discovery, 90 vaccines were already in clinical phase of development. This is absolutely remarkable. This is something which would be remembered as a landmark year for science and technology deployment, and the promise with science and technology fulfilled. So new vaccine development, new technology came forth, which will make possible to develop new vaccines in the future also. And in December, we were already dispensing vaccines to population. And that was a landmark achievement for science and technology, because where everything else failed in terms of international economic and humanitarian cooperation, economic cooperation was all-time low. Human, welfare cooperation was very, very low. Also, countries were absolutely self-centered. And at that point of time, science and technology has worked, and scientists and technologies have worked closely with each other to combat this major health crisis. So development during COVID-19 pandemic illustrate the speed at which science has progressed, attention it has received, and most importantly, trust it has developed, and expectation it has created. This is the picture of a world where science had not responded. So-called natural herd immunity, 70% of the people get infected, and then we develop this natural herd immunity. The spread had to continue for literally years and years, and over 5 billion people had to be infected in order to achieve this 70% of herd immunity. And 100 million people with the lowest mortality rate ever reported from any country. Taking that into account, 100 billion people had to die, and literally billions of people have to live with morbidities developed due to infection. This was without science. So science has played an extremely important role. Now we need to understand where it all happened. This is very, very important. It didn't really happen all over. It didn't happen in all countries. This happened only in global north, with the exception of a few developing countries. Institutions and organizations with existing strength. And this is important because we need to understand that we need to develop our institutional strength, because these are the institutions who respond to a crisis. And without developing indigenous institutional strength, it's not possible that we will be able to handle any major health crisis in the future. So industries which were already in the business of vaccine and diagnostic manufacturing, they were the one who brought these vaccines. Nations which were strong in science and technology were the one who brought these solutions. While the rest of the world is completely dependent, as we see now, 80% of the vaccine is available for the rich and only very little for the poor nations of the world. Pakistan has been a good example to begin with. In the first two waves, Pakistan performance was very, very good. It has been it has been taken as one of the best practices in the world. It was regimented, it was well coordinated, largely because in the decision-making process, health professionals and doctors were taken on board. And literally on every board, from provincial to federal, every committee, there were representation of scientists, social scientists, healthcare professionals, experts of infectious diseases. They were sitting there to take decisions with the political leadership, and that has played an extremely important role in Pakistan's good response in the beginning of this pandemic. I would like to give you examples of what has happened from zero capacity to now about 70,000 tests. 70,000 tests uh, was achieved in 4 months' time. From literally zero laboratory to 130 lab in public sector and about 60 labs in private sector. And these are the data which is available on NCOC website. Uh, Many super labs were established. So from no capacity to literally thousands of tests, we have achieved that within few months. And that is something which we can take pride on. This is Pakistan Forensic Science Laboratory, Punjab Physics Science Agency, where a large laboratory was set up within 2 weeks. Remarkable development. This is National Institute of Virology in ICCBS, which was established in 2018 for research on viral diseases. It's large, perhaps the largest BSL-3 facility with about 5,000 square feet of laboratory space in BSL-3 was converted into a testing facility. And then there were Protect clinical trial, which was listed internationally, and many hospitals and healthcare universities were engaged in this clinical trial, conducted purely by Pakistani physicians and doctors. And it was taken as an example of a good repurposing clinical trial. This is Protect clinical trial study. The details are available on the website of University of Health Sciences. Many study centers and then ventilators. Many of these ventilators were developed. Prototype of these ventilators were developed. Now we have to handhold. We need to make sure that initial development go into the marketing phase, because technology is always iteration. You develop something, you improve it, you further improve it, and then we can't really expect a ventilator manufactured in Pakistan is as good as ventilators from USA or European countries. But of course, we need to invest in development of these biomedical devices, which our engineers have developed. So many of these devices were manufactured. There was a large exhibition in which we invited, this was in Comstock, we invited Prime Minister of Pakistan, and that we presented what was developed. This was in April 29th. So within a few weeks, Pakistani scientists, scholars, technologists, and universities were already responding. Genomic surveillance is extremely important. We all understand how important it is in the context of India. India, in every state, there is a consortium of genomic surveillance, and there is a nationwide effort. It is very important for us to have a very large scale genomic surveillance with many institutions involved, but this is what has happened in ICCBS, and we have reported so far 77 genome sequences of SARS-CoV, which indicate fast changing mutations in the local variety, and it would not be very surprising that we at some point of time have the emergence of Pakistani strain or Pakistani variant. I don't want to go into the detail of these scientific discoveries. I just want to tell you that many very bright scientists of our institution have worked in the field of in silico identification, culturing of SARS-CoV virus, and they have reported this in many research papers which came into world literature in first few months. Equally important was clinical trials. So we were engaged in first clinical trial, the Sinopharm vaccine, which we have in Pakistan, the first line vaccine which was used in Pakistan before CanSino came. The first phase clinical trial was conducted in Pakistan, and this was done in ICCBS in collaboration with other hospitals. We also are engaged in traditional Chinese medicine clinical trial, phase 1 and phase 2 clinical trials, and phase 3 clinical trial of another vaccine is planned in near future. So these clinical trials were conducted in Center for Clinical Studies in Biosay. And then, many other projects were initiated in National Institute of Virology. Without taking much of your time, I would like to focus at the end, what are the challenges and way forward for Pakistan? You see, pandemic has taught us that no one will come to help us in global crisis, and this is true for every country. We all have to develop our own indigenous capacity, because when there is a global crisis, the human response is very self-centered. We become so self-centered that we try to solve our own problems, and no one cares about the other countries. That we have seen in initial few months, that literally in European Union and other economic bloc also, countries were fighting their own war, and no one came to help them. Then there is another challenge of 220 million people. If we want to vaccinate 60 or 70% of it, we need to have a huge capacity to dispense, mobilize, and to manufacture a vaccine. And not only today, but perhaps in future also, because as we see, if COVID-19 would remain there, and perhaps people would need to have multiple vaccination in their lifetime. So for a nation of 220 million strong, we are literally dependent on others, and it is important that we develop our own capacity to manufacture essential vaccines, which are currently imported, and also to develop our own vaccines for COVID-19. And that without indigenous science and technology capacity and strong institutions and linkages with the industry, we will be dependent on others forever. Therefore, expenditures on public healthcare research are extremely important. And this is what we are trying to do at the federal level also. Pakistan is known, unfortunately, for very large scale viral disease load, very few trained professionals in the field of virology, and that has to be strengthened also. There is a need of institutional infrastructure in virology and vaccine development. So there is both in terms of human capacity development and institutional development. It is important that we build our capacity, and there are only very few high containment facilities which need to be strengthened and increase in number, because this is not the last pandemic. Perhaps it is one of many pandemics which will come in future as well. So we need to understand that a new pattern is emerging, and this is a great challenge for us. When countries of the West, who already overbooked about 80% of the vaccine for literally years to come, they would be opening up. We have seen what is happening in many Western countries, that they are capable, they were able to vaccinate 50% of their population, and situation is improving there. On the other hand, countries like ours are now global outcasts. In last 1.5 weeks, 46 countries have banned travel from Pakistan. So this is a snapshot of what will happen in future if we do not really put our act together. It is important that we act very promptly, otherwise the world will be opening up and will be closing down. It is important for us to prepare ourselves for waves and waves of these COVID-19 for future. The travel restrictions for Pakistanis and the people who are coming to Pakistan would really affect our economy, affect our science and technology linkages, academic linkages, our relationship with the world. So it is important that we keep these air corridors open, and that this new Pakistani variant, which is not very unlikely, can create a real disaster for the country. So we need to prepare for it. And science is the way forward for Pakistan. Building science and technology capacity in healthcare is extremely important. We need to invest in institutions and human resources, and science should become the core and center of national policy regime, and that we have to develop linkages between industry, government, and research and development institutions. This so-called triple helix model, and that we need to invest into healthcare research and healthcare system, and a system which is equally accessible to everyone. And we need to train literally thousands of young scientists in the field of virology, genomics, diagnostics, immunology, and other critically important fields. We need to strengthen our existing virology laboratories. We need to have at least one BSL-4 for very dangerous infectious diseases which may appear in future, and that we have to have a large diagnostic network within the country. And of course, it is extremely important that we develop national disease surveillance for all infectious diseases. Pakistan has to understand that disaster is coming forth, and that we need to train our healthcare professionals, scientists, our policymakers, our parliamentarians, our civil military R&D regimes in understanding that these disasters are very much reality of the future, that we all have to work together to handle future health crises. Post-COVID world would be very different. Ideally, it has to be a world where health become a central regime. Health and nutrition, clean water, sanitation, that become a central regime for all global strategic, local and international intervention. That we have to develop this one health solution, that we have to think of a healthy planet, and that SDGs need to be rearranged with the critical goals. And these critical goals are, as I mentioned, are more related to human health than anything else. So these are the future challenges, and we all have to understand that if there is ever a post-COVID world, this would be a pre-pandemic period, because all prediction says that the next pandemic is just a few years away from us, and that we have to prepare ourselves for future health challenges. Thank you very much for listening to me. These are some of my thoughts, but I'm sure that there are a lot more will come in this workshop, and that we would be able to learn from other experts as well. Thank you.
Thank you very much, sir, for excellent presentation and for your time. Now, I think a lot of questions that people would like to ask you. I will request Hafsa to please throw the question from the sir. Hafsa, please ask the question.
There's a question from Niaz Hussain. I have unmuted their mic. Yes, can you ask your question?
Yes. Yes, I have a question.
Yeah, please. Go ahead.
The question is that how are the vaccines? How can we?
Sorry, can you repeat the
How
question?
we ensure the vaccines?
How? I'm sorry, your voice is not clear, Niaz. Please, can you repeat it loudly?
How how we can ensure the vaccines no adage to the vaccinated people are to the people?
Yeah, I think it's a very important question. See, as I said, that indigenous capacity for vaccine development is critically important. You can see by all projection that, with some donation and some COVAX, I don't know when the COVAX vaccine would be available. There's absolutely no way that we can vaccinate a majority of the population. And this is not today, but even future also, because according to WHO, this is a flu-like pandemic, and perhaps we would be needing booster shots in every second year or third year. So it is critically important that sixth most populous country of the world, Pakistan, must have its own vaccine development and manufacturing facility. And critically important that we develop our own capacity to manufacture vaccine for the local need, as well as for the need of other countries. And it can be done, it is possible if we have right kind of manpower, lots of bright people, and if we train them rightly and cluster them into good institutions and link them with the industry, it would be possible to develop our own capacity in the field of vaccine development.
There's another question about what we can do as a microbiologist to control the current situation.
See, microbiology is a core discipline for fighting any infectious disease, is critically important. And we have seen that over the years, we have seen the emergence of resistance in different bacterial, fungal, parasitic infections. We have seen that, these local infections have attracted global attention also when Nature published an article about multi-drug resistance typhoid in Pakistan. So it is critically important that microbiology, including virology, take a central role in fighting the infectious disease. We need to understand that it is not only treatment which is important, and access to treatment is also important, but equally important is the research, understanding why these diseases are so prevalent, what are the causes of the prevalence of these diseases, how this whole epidemiology of infections are emerging. So microbiology is a critically important discipline, and we need to strengthen that discipline, and also to develop our capacity of research in the field of microbiology.
There's another question about why Pakistan isn't making its own vaccine.
See, Pakistan has been largely dependent on import. We are among the only two countries where we have polio. Even polio vaccine is imported. Literally, our capacity to manufacture vaccine from poultry to livestock to human is close to zero, which is a great tragedy. And I think this is largely because we have been relying so much on import that we thought it is not necessary to develop our own capacity. But it is a time for us to understand that this is not on. That sometimes you have money, but nobody would give you vaccine like today. Pakistan has set aside 165 million rupees, but nobody is willing to sell vaccine to Pakistan because the manufacturing capacity is overbooked for several years. So how can we do that? I think it's important that we select one or two good institutions, select very bright young people, get them trained in the field of vaccine technology. It's not rocket science, it can be done. And then provide them right atmosphere, right equipment, a good institutional infrastructure, a sustained funding, and link them with the industry, because these research and development institutions cannot really manufacture vaccine for the whole country. They can only develop technologies. The manufacturing and production has to be done by private sector. So linking it with the private sector And it's just a 3 years project. I'm really confident that within 3 years, through a sustained effort, we can develop our own capacity. We have seen in OIC look after this ComStack, and we know that biopharma in Indonesia is manufacturing about 80% of the vaccine which Indonesia need, and exporting vaccine to many countries. Same in Iran. Iran is self-sufficient in vaccine production. Very much has been developed in Bangladesh and Turkey. So it is doable, and it can be done with the sustained financial support, proper planning, and linkages with the industry.
Okay, someone has asked, where are we standing for the One Health concept in Pakistan? Like, what is the progress we have made so far?
Uh, Very honestly, I think our understanding of One Health concept has been largely rudimentary, very basic, though it is extremely important. We all have to understand that, and this COVID-19 has shown everyone. I mean, if there was a very little understanding, at least this appreciation of the fact that many of our diseases which we suffer today are zoonotic in nature. So we need to understand that human-animal interaction is critically important, and that it is very, very important for us to have a, a system in which we take care of not only human health, but animal health, and also the health of the planet. So all three components of interaction uh, and this nexus remain on a very good term. It should not really invade one sphere to the other. And the concept of One Health is extremely important. I suggest that some of the future conferences and events should be focused on One Health concept. So our young researchers understand the importance of this very important and centrally critical concept of healthcare for future.
Thank you so much, sir. I think with this, we will end with your presentation, and I'm extremely thankful for your time that you took out the time of your busy schedule and the excellent presentation that you share the resources that you have and the work that you have done at your institution. And you are doing a wonderful job at not only a national level but at the international level. So you are, of course, a role model for us, and I am extremely thankful that you enlighten us, especially the young scientists and researchers and students who would like you to follow in future, and they want to contribute their role and the upcoming events that are coming. As you very well mentioned, that it's not the end of the pandemics, rather it's maybe the beginning or many more that have to come. So we need to be prepared and should play our part in that. Thank you so much. Now we will proceed for the next presentation. This webinar consists of the three parts. The first one is the speaker, the guest speaker. The next one would be the awareness session, that today we are going to compare the India and Pakistan pandemic. And the last, we will introduce you to the ASM resources. So Hafsa, you would like to intervene or should proceed? Okay. So thanks to Dr. Iqbal, I will proceed for the next presentation, and you can keep your question with you. We would like you to answer those questions at the end. May I share my presentation? If I can share this from here. Can you see my slide? Okay, so everyone is aware of the Indian situation, that is a catastrophic situation in the India part, that more than 3 lakh or 300,000 cases every day they're reporting with new cases of COVID, and thousands of deaths are reported every day. So this situation is quite alarming, and how Pakistan can learn lessons from this and can prevent themselves from such situation, as no one can afford such situation. our lives, and prayers are with the Indians parts that this pandemic should end as soon as possible. But we should also learn lesson that it can happen anywhere. So if you see the statistics that the global numbers, more than 147 million people being affected with this pandemic, and many more they are infecting day by day. So the number is not yet, and it will continue. As you can see these statistics, the number are on rise day by day, and the number of deaths are also on rise, and thousands of people being affected and died due to COVID across the globe. And as you can see these graphs and bars is indicating that daily new confirmed cases of COVID-19, more than 800,000 cases daily being reported. So it's a huge number. You can understand that how this pandemic is devastating the scenario of the globe. And it's not only one country that is affecting, rather everyone is affected. Even where there is no or less cases of COVID, still the life is affected. And the daily routine being affected badly. It's not only that the health sector is hit by the COVID, but rather the other area of social structure is badly damaged. So the newly confirmed cases from the second wave, as you can see, that we easily survived the first wave and even the second wave. But this third wave is drastically affecting the world with the new scenario, because we have the new horizon of the virus being changed and mutated, and it's behaving nasty as compared to the first and second wave. So the numbers are increasing day by day, and already steps taken are not enough anymore, and we need to move forward with more resources, with more science, as discussed by Dr. Iqbal, that we need to bring all our brains in front of everyone, that we should share our resources and pool our resources to fight together with this infection. And these numbers indicating that more than 147 million people being affected, and more than 3 million being already died. The death rate is more than 3 million, and death rate is daily increases day by day. So the cumulative effect of this, that it's the slogan that we usually raise, that no one is safe until everyone is safe. We need to make the world safe. Only then we can remain safe. If any corner of the world is affected, still there is a chance that the virus will reach somewhere to us, and we can be affected. So no matter in which part of the country the COVID is there, we need to bring solution to resolve the pandemic. These are the statistics in India, which is very high numbers. You can see the total number of cases in India, and the number of deaths that which are very high, and every day the number of about more than 2,000 or 3,000 cases or deaths are reported every day these days in India, which is the highest number at the moment. Pakistan is far behind in numbers, but the trend is on rise. 800,000 people being affected so far, and the death rate is not that high as compared to India, because India is a very large populated country. So this 17,000 number is pretty high for us, but it may be increased, because the critical cases every day that we are reporting from the data is more than 5,000 now, which is the highest since the pandemic began in Pakistan. And the trend that I'm saying, that the number is low at the moment, but the trend that we are reporting and we are getting from this government is quite alarming, that we need to take steps. Otherwise we may be affected badly. These are the numbers which are showing that confirmed deaths in India and in Pakistan, which already been discussed in the previous slide as well. But it's indicating that the trend is on rise. This bar is towards the sky, and in Pakistan it's also on rise. So the trend is on increasing numbers of deaths is Pakistan as well as in India. The daily confirmed deaths, about more than 2,000 cases, more than 2,000 deaths every day happening in India, and about 125 deaths in Pakistan. So the trend is on rise. It's not only the number, but the trend is on rise, and that's why we are very much concerned and worried about that this number may be rise very soon. The total number of tests that being performed in India is far more higher than us, and this is indicating that number of tests done per thousand population. So about 200 tests per thousand population being done in India, and only 52 tests per thousand no, population number is in Pakistan. So it's already indicating that we need to increase our tests so we can have a real picture in Pakistan what exactly happening in terms of numbers and how many people are really infected. So far, only the people who are coming to the laboratories and hospitals for testing, only those cases being reported. The new phenomena in this third wave is the variants. The introduction of the variants are genetically modified or genetically different structure of the virus, which is currently aiding to the current pool of the pandemic, which is making the situation even worse, including the UK variant that is called B117, and the South African variant, that is B1351, and the Brazilian, the nasty one was the P1 variant. And India, which is current reports, which is indicating that the current variant in India, that is B1617, which is called the double mutated virus, which includes the variation of the mutation from the California variant virus and from the South Africa, the UK variant virus. So this is accumulating the double mutation, and the result is in front of you that the population of India is badly affected, and you can see in this picture that how the people are affecting across the India, and we can see visual in which people are lying on the ground, and the hospital are full with more than the available capacity. The oxygen supply is limited, and all the resources being exhausted, which is leading to a very catastrophic effect, and even more deaths may occur in current days because the virus is spread throughout the country, and there's hardly any situation that we can be able to deal with this. So India health system is malfunctioning at the moment, and in catastrophic second wave of the virus, with hospitals filled beyond the capacity and are unable to care for any new patient, and a shortage of oxygen also even worsen the situation, because if the patient is admitted in the hospital and he or she is not getting the oxygen, how you can save her or his life. So this situation, no matter how much capacity you have, if you have that much number of cases, like more than 300,000 cases every day, you are adding to the current pool of the patient and the hospital. No country can afford this. So even India is a huge country, and they may have a huge resources, but no resources will be enough to deal with such numbers. So and day by day, you have even more cases adding to this. So the current situation in Pakistan is also not very good, and the situation in Pakistan and India, if we compare, and the trend is on rise, and in India it's already touching the sky and even not stopping at the moment. So the situation also indicating in Pakistan that we need to take some serious steps to prevent ourselves from reaching to that situation which is in India. Otherwise, the situation, if you can see in Pakistan, surprised everyone in the first phase, because as Dr. Iqbal mentioned, that the response from the government, from the people of and population was very much coordinated, and we were able to contain the pandemic to a very low level, and the number of cases, the number of deaths was easy to control. But the current scenario with the new trends of the variants, we are reporting more than 2,000 cases in April only, which was much lesser in the first wave and the second wave. And the resources that we have in comparison with India is far more lesser, so we cannot afford to reach to that number. So at least 10% of the positive rate of this month is microbiologist
Please hold a few minutes. We'll try to reconnect Dr. Saeed again. In the meantime, can you please fill out the form so that we get your details and we can submit the certificate to you. Make sure you use your correct spelling and your correct details. If you have any questions, you can send them in the chat box or you can wait till the end of the session. So we will take the questions then. For your previous certificates, if you haven't received them, you can check your spam folders or you can send us an email at park.asmambassador@gmail.com and you will we can like facilitate you then whatever queries you have regarding previous sessions or the current session. We can acknowledge you over there.
Now you can hear me? Okay. So I was comparing the two countries' situations. That in numbers we are behind in numbers, but the trend that are towards the, if you see the R node is increasing month by month. In April it is increased tremendously. So the R node mean that a person, an infected person, can infect how many further sensitive persons. So these are the numbers which are increased, and the situation is worse not only because of the variants that we are getting in this third wave, but you can see this picture that how much the population is contributing to spread the infection. And the situation, if we can compare, is not different on both sides. The large gathering, and you can, if you can go the market, in the religious gatherings or the bazaar in the market. So overcrowded population elsewhere, and they are exchanging these viruses and variants together, and it is contributing drastically and worsen the situation further. The alarming situation is also further worsened because of the variants, as we discussed. In Pakistan, it's been reported that the UK variant was there in Punjab and different city of Punjab and KP, and now it's also being reported in the province of Sindh, particularly in Karachi. So, and after that, the number of cases increasing very rapidly. The vaccination, if we can compare the vaccination side, we are also behind from the rest of the world. If we compare us with the United States, they are are injecting more than 3 million doses a day, and we are left behind. So far in Pakistan, we have only vaccinated 2 million people. So which is very much, which is very less, and we need to further increase it. And on India side, only 1.6% of the population being vaccinated. So how we can expect, if we keep on exchanging the virus with such gathering without following the SOPs, and we are not vaccinating our population, so the results are there, and you can see that how badly the situation are in India, and God forbid that it can be also in Pakistan if we are not going to take it seriously. The Pakistan COVID vaccine program is daily, on daily basis, they are improving, and we have lucky to have the National Command and Control, that is NCOC, which is directing the whole situation in Pakistan, and they are improving the supply of the vaccine and process of the vaccination center. As somewhere it was mentioned that vaccine does not prevent, rather vaccination. So vaccination is the answer for the pandemic. If we are just talking about the vaccine and not vaccinated our population, it will not be helpful to deal with this pandemic. Okay, so this what we have for the comparison. The key words that I would like to share is we have similar scenario on both sides. Though Pakistan is far more behind in numbers because we have less population as compared to India, but the trend that we are seeing in this third wave and the situation and the markets and outside the houses and the hospitals, the gathered large gathering and without following the SOPs may also worsen the situation in Pakistan as well. So at the end, I would like to share the ASM resources as well, that everyone is invited to join the ASM as a member. And recently, the one of the conferences going to be held soon with the ASM microbe. So everyone is encouraged to participate in this conference, and they can submit their abstracts through online. The good thing that if you don't need to go, but you can present your research with peers on the web from your computer. So it's easy for you to go and submit your abstract, and if it gets accepted, you can present from your laptop or computer. We have also created our group, the ASM Pakistan ambassador group. You can also join that and become ASM member. We have give you this link. You can follow this YouTube channel. One of ASM members, she is brilliantly made this video. Atifa, I always encourage her that she is encouraging the young students to become a member. So this is a very nice video. You can click on this link and see the video how to become a ASM member. You can also join us on the Facebook page, and this is the link you can join us through. If you have any question at the moment, I'll be more than happy to answer.
Sorry. Assalamu alaikum, sir.
Wa alaikum salam.
Sir, I have two questions. First question is that COVID virus is being mutated by spreading. And we always hear that we are having a third strain or second strain. So how long can we predict that this virus is going to stay in this world? And the second question is that we also know that New Zealand is the country that is COVID free or have very least number of COVID patients. So why don't we adopt their COVID control measurements?
Yeah, it's a very excellent question. I will answer the first question first, that how long the virus will keep on mutated. So there is hardly any answer to this. Till the virus will remain in the world, it will keep on mutating, because the virus has this capacity to tackle with the selective pressure from the immune system of any of the antivirals. So if it is any immune pressure, being a human, if it is infected, then the immune system try to clear the virus, and the virus modify itself to escape from the immune system. Or if you are using any antiviral, so it will again try to escape from there. So the virus will remain there, and no one knows that how long it will stay, but it will keep on changing, and we never know that how we will be able to clear it until we follow all the SOPs and we eliminate from the society and from the every corner of the world. So like the other SARS viruses, and they are no more in with us now, because we try and our level best and follow the SOPs. So at the same, if we remove this virus from all the humans, so it will be eliminated. But it is not an easy task. We need to work hard for that. So the vaccine would be the solution for the time being. The other question that you have asked regarding the New Zealand, I think if the will is there and the commitment is there, we can do that. But that is theoretical for us. Practically, if you go outside your home, how do you see situation like in New Zealand? Even in your house, everyone is following all the SOPs, including us. So no one is trying that hard, but they're expecting that we may be able to get the same results. So if you have, and the government and everyone, and as an individual, we have sure commitment, we can do it theoretically, but practically we need to do the same efforts as they are doing.
There's a question on how to address vaccine hesitancy in Pakistan.
Yeah, this is a question everyone asking that how the simply answer. Yesterday I was looking different literature that about a billion population being vaccinated so far. So, and hardly any serious or severe effect over there. So, if too much people being vaccinated throughout the world and they didn't develop any severe effects except from a few hundred people. So then what else we need to prove that vaccine is safe? We should go and get ourselves vaccinated. So if we are committed and we are taking this disease seriously, then we can easily remove this hesitation. Otherwise, if we keep on asking questions from everyone and not going to get ourselves vaccinated or not asking from the people who are already vaccinated. If you go and ask a person who is already vaccinated, he or she will just tell you that the vaccine is was safe, except a little bit pain that you will feel with every injection, a little bit fever that you may have. That is far more better than the COVID infection that may, God forbid, take you to the hospital or to the ICU even. So it's better to use the effective.
Are we screening for the mutations in current positive patients?
Yeah, we are not exactly screening, but random sampling being picked up because at the moment we don't have that large scale strategy because most of the variants need to be screened by sequencing. So we don't have that frequent sequencing facility in the country, except a few of the laboratories and institutions. They have the NGS or the Sanger sequencer. So only those institutions they are doing this mutation screening. Recently, we have developed our own assay that through PCR we can also detect the existing variant. But with the PCR, we have this limitation that we can only detect the known variants for which we know the primer and the probes. Only that area we can target. So we are in our own laboratory. We also screen the variants, but we need to screen it on a large scale. So the government, the health department should be able to take decisions and develop their policy according to the prevalent mutation, mutated strain, and the society and our population. So we need to work on that further.
Someone has asked with the new strains, there are new symptoms like nose bleeding, diarrhea, etc. So if this is true or not?
Yeah, this slide is quite naive for us, and every day is depicting some different symptoms. So currently, the symptoms being updated, and it's not with this variant; it's with the previous wave as well. Initially, the simple fever, headache, and body ache was there, and the next wave we observed that the loss of smell and taste was there, and the body discomfort of the stomach appear with the new symptoms. So currently, some of the patients come with very mild even symptoms and asymptomatic, and they become proven with the COVID-19. So you are right, their new symptoms are updating with time, and we need to be vigilant. That's why we should not rely only on symptoms. The laboratory tests must be confirming the COVID-19 are different variants. So we are there as a either the symptom is due to typhoid or malaria or some other infection or just because of the COVID. So the laboratory test will provide the answer. And your role is being a microbiologist is there that we are so important for the this word and for the doctors and physicians that without your advice, the physician cannot take decisions. So you need to be proud to be a microbiologist. Any other questions? Nazimuddin has raised his hand.
Yes, I've unmuted his
Nizamuddin.
mic.
Nizam, please unmute yourself.
Okay. I am Nizamuddin, Manager Quality at Pakistan. First of all, I would like to thank you for arranging the session on the hot topic of the day and sharing valuable updates regarding the COVID-19 vaccine. I have some questions regarding the composition and efficiency of vaccines developed so far against the COVID-19. Basically, I was approached via.
Can you a bit louder? I can't hear you.
Okay. Well, I was approached via Darul Aftab to elaborate the contents of available vaccine. So, are you able to have comments on biological and chemical contents of vaccine? And secondly, how effective is the vaccine for all available variants in Pakistan?
Okay, so Nizam, very good question. Thank you for asking this question. There are different vaccines with different chemistry. So far, we have 5 vaccines approved in Pakistan. 2 of them are the whole virus, inactivated virus. So the virus is a live virus being inactivated, the genome being destroyed, and is a mixture of proteins. So those inactivated virus behave like a mock virus. It's not causing infection in the body, but it's activating the immune system. So the Sinopharm and the Sinovac is of that chemistry. Then we have the 2 other vaccine, rather the 3. The CanSino, this is from China, the Sputnik from Russia, and the AstraZeneca from Oxford. These 3 vaccines are vector-based vaccines, which has the adenovector virus. The adenovirus is a vector being used in that, and the spike protein region being used as a marker of antigen. So this is the next chemistry that we have. So other than this, some other vaccines chemistry are there, like Moderna and Pfizer vaccine. They are based on the mRNA vaccine. So we don't have those vaccine at the moment in Pakistan. We have rather these 2 types of chemistry of vaccine, which is inactivated virus, Sinopharm and Sinovac, and the vector-based, viral vector-based vaccine. The adenovirus is used as a vector, and AstraZeneca, CanSino, and the Sputnik 5. So these are the vaccine chemistry that we have so far in the vaccine that is used in Pakistan. What was the other question? Ishtiaq Shah, please go ahead, unmute Dr. Ishtiaq. Ishtiaq Shah, you are unmuted from our side. You can unmute yourself. Ishtiaq, can you hear us? If you have any question, you can unmute yourself and ask the question. I think Ishtiaq is not listening us, or something going wrong with it. You can write in the chat box if you cannot unmute yourself.
There's a question about how we were able to control SARS and MERS, but we haven't been able to control SARS-CoV-2. So why is that?
Yeah, that's a very interesting question. That's why I was saying that we can control it if we try. The 2 things are very much important with if we compare the MRSA and the SARS is the R naught. The R naught was less than the COVID-19 or the SARS-CoV-2. So the R naught meant how many person can be infected by an already infected person. So the R naught is much higher than in case of SARS-CoV-2 as compared to, and the lethality is high. When the lethality is high, like the more fatal the virus, it means the transmission can be not that high, because if the person die, he will not stay for longer period in the population. So with the high mortality rate and the lesser infectivity rate, that is the true reason that being contained the SARS and the MERS, the virus was easily restricted, not from spreading in the community. But on contrary, the SARS-CoV-2, the infectivity rate is much higher than the rest of the 2 viruses, and the lethality is less, because we have a lot of asymptomatic patients in the society. They keep on spreading. they are existing in the community and they are spreading the virus to many other people. So if the lethality or the symptom was too high, then a symptomatic person can easily be restricted or quarantined as compared to the asymptomatic or less symptomatic person or patient. So we need to take every patient very seriously. That's why we are keep on asking that if we take this disease seriously and even being asymptomatic or less symptomatic, we need to take care of ourselves or that patient to restrict that patient to quarantine or restricted area that he or she should not spread the virus further. Otherwise, as you see that they are nowadays more than two now, and one person can infect even 3%, or in some cases even more. And these variants, if you can see that the variants are not being already increased. Any other question?
Sir Ishtiaq has asked that despite India having their own vaccine, why is their situation getting worse?
We don't have our own virus in vaccine in Pakistan. That's all the question.
India has its own vaccine, but still the situation is getting worse. Why is that?
Oh, that's yesterday. I mentioned this in the news channel as well, that a vaccine in the fridge or a freezer won't work until it's been injected into the person or the population. Only 1.6% of the population being vaccinated. So how you can expect that vaccination will work? So if they have vaccine, they are better to go and proceed to vaccinate the population. Only then they can expect. But if they have the large-scale vaccination and they are providing to other countries or selling the vaccine, so their population is not yet being vaccinated. So if they been able to vaccinate their population, at least 50% of the population being vaccinated, only then they can expect that the virus will not spread that much. At the moment, only the data is showing only 1.6% of the population, and you can expect how big the population is. 1.6 is nothing. So they need to vaccinate large scale. And so this is a lesson for us. In Pakistan, even the vaccination rate is much lesser than that. So we have not vaccinated that much of our population. We need to vaccinate our population at large scale. We should provide more vaccine in terms of quantity, and in terms of setting up the more setup for the vaccination centers. We need to facilitate, we need to educate, we need to aware our population and address their concerns. Only then the population will take interest and come to the vaccination center. Otherwise, if they have hesitation, they are not coming for vaccination. If you have vaccine in the fridge, in the freezer, it is not enough. It will not provide any protection.
Why is the government making it compulsory for everyone who works there to get vaccinated?
So the government is asking everyone to be vaccinated, and they are providing the opportunity. So compulsory, of course, time will come that it will become compulsory. But at this stage, they are encouraging to ask the people to be volunteer, and in the meanwhile, they need to provide the quantity as well. If they make it compulsory at the moment, they don't have that much vials or the doses for each and every person. So with time, they are keep on providing the vaccine, and they are encouraging and promoting the campaign that everyone should contribute voluntarily, and instead of being forcefully bringing them to the vaccination center, as being our responsible citizen and a part of the society, it is our part and just your part also, being a microbiologist, that you educate the people and within your home and your vicinity and your villages particularly, that you educate them that their vaccine is very safe. There's no side effect, or few of the side effects is very mild, and the benefit is far more better than the risk of being infected with the COVID. So please come, get yourself vaccinated, and spread this message throughout. Being a microbiologist, you know that inactivated virus cannot do anything except it provoke the immune system. And if you have a provoked immune system, then if the real virus comes, it will fight with that virus and you will not face the infection. And if you get infected even, you will not, severe disease will not occur and you won't go to like hospital or severe disease condition. So this is the phenomena which, being a microbiologist and immunologist, you can understand and can spread this message throughout. More raised hands are there, so we can take the last two questions.
Assalamu alaikum, sir. I want to know something about it, the discovery of the corona vaccine in a very short duration of time. Secondly, I want to know some side effects by name of the coronavirus. Thirdly, the previous sir is saying that we have spent a lot of money to buy the vaccine from the foreign countries and they are not selling this to us. So what will be your opinion about this statement?
Yeah, the last question first, because everyone is securing their own community. Like in US, if they have a good vaccine, but that they are not selling until they vaccinate all their population. So this is an example that they are not going to sell it to you, though everyone is ready to get the Pfizer and the Moderna vaccine, and they are ready to pay, but they are not the US or the Western country. They will not sell the vaccine until they vaccinate their own population. So this is the priority thing that are coming there. The first question that you asked, that in short term we have the vaccine, which is good thing. Instead of waiting for years and years to have a vaccine, and pandemic destroy the whole of the population of the world. So it's a good thing that we have the vaccine at short time. And parallel, it's not the short time. It's a lot of money being pulled, and a lot of people were involved, and all the steps, like if you go and check, being a microbiologist, how vaccine been produced. It is a preclinical trial, a clinical trial, phase 1, 2, 3, and 4. This is the process for any of the vaccine. So if you take years and years in this process, or if you take these on priority and run the trial on parallel basis, so in this case, because of and the priority and hurry, because we cannot wait. It's not like a malaria that only 1 or 2% will be affected, and you can wait years and years for a good vaccine. So the scientists pool their knowledge, and the government pool their money, and parallel studies were done, like preclinical trial, then phase 1 and phase 2 clinical trial together parallel being done. And after being successful trials, only then following the SOPs, these vaccines were allowed to be used. So this was the priority basis, that the resources were pooled, and the scientists worked together, and they have been able to produce these vaccines. And you can see that a billion doses being introduced into the population, and you can see the results of the vaccine. You can see the result in Israel. You can see result in the USA. They have vaccinated a large scale of population, and all the people who've been vaccinated, they are almost no infection or very less infection with mild symptoms. So this is very much reality in front of us. Instead of going into conspiracy, it's better to see the wall written on the wall, and we need to be a part of that scientific community instead of the rumors and the conspiracy theory. Okay, I think with this we need to conclude the sessions. If you have further questions, you can email to us, and we will be happy to answer on email as well, because the time is short. We need to wind up the session. Thank you so much for everyone for spending time out of your busy schedule, and because beside of the Ramadan. I'm also thankful once again to Professor Dr. Iqbal for joining us today out of his busy schedule, and it was wonderful to have him with us. And thank you very much. We will be keep on having these sessions every Wednesday. So please stay with us for every Wednesday. And if you have any suggestions, queries, or any comments, feel free to write to us on the email that Hafsa will be sharing with you. And don't forget to file up your form, because everyone is asking for certificates without filling these forms. So if you don't have the data with us, and these forms are not filled, we will not be able to send you the certificate. Thank you so much. Allah Hafiz.
Thank you so much, Dr. Saeed and Dr. Iqbal. Thank you to all the participants for your attendance today. For your certificate registration, please make sure that you have filled out the form link with your correct details and your correct spelling. We only enter the spellings in the certificates that you provide us, so make sure you have entered the correct detail. Secondly, if you haven't received your previous certificates, please check your spam folders, or you can send us an email at park.asmambassador@gmail.com for any queries that you have. We will see you next week with a new session. Till then, stay tuned for details. Take care.